There was a Roth-Williams Functional Orthodontics, which was a 2-year course out in California. That deals a lot with doing a lot more intensive diagnosis and treatment planning to try to establish the proper position for the functioning jaw, not just necessarily where the teeth look good and fit good. It's just trying to establish the proper foundation first. That was a pretty intensive course. And then I went to a 1-year course with Ron Coney International, also out in California. He's also a fellow Roth trained decades ago, but he teaches a course that deals with clinical efficiency. How do you make treatment in the clinic more efficient and more effective so that it kind of shortens down the treatment time for the patient? And then also the other big one that he has is early treatment, where he tries to do some of the earlier treatment on say the 8-9-year-olds to try to get some corrections done before they've gone through their big growth spurts, because you can kind of get a lot of stuff like much better airway, facial development, arch development, so that you don't have as much to deal with extractions. But the big ones like airway, not really important as a kid so much, but as they get older and older, you start having the ones that, like snoring is because there's not enough airway a lot of times, sleep apnea, things like that. You can try to prevent a lot of that if you can catch them when they're early, and the results are better than if you just try to do it all as a teenager. So that was the big one I got out of him. And then also just recently completed the Invisalign. That's another one. It's like the last few years I've done a lot of Invisalign continuing education, and just finished this year the Invisalign Master's Program, which I'm actually the only orthodontist in Montgomery County here that's gone through that training, which has been really helpful in being able to treat more difficult cases. So a lot of those people that are used to hearing that, oh, you're not an Invisalign case, or oh, that didn't work for me, that type of stuff, it's like, well, there's good likelihood if you've gone through this training, you would know how to correct some of those things or actually treat some of these people that have been told that they can't do it that way in the past.